Let's talk about the most common mineral deficiency in the world. Can you guess what the most common mineral deficiency in the world is? It is of iron deficiency. In this video we are gonna talk about symptoms, causes and prevention of iron deficiency. Iron deficiency anemia is a common type of anemia, a condition in which blood lacks adequate healthy red blood cells. Red blood cells carry oxygen to the body's tissues. As the name implies, iron deficiency anemia is due to insufficient iron. Without enough iron, your body can't produce enough of a substance in red blood cells that enables them to carry oxygen, hemoglobin. As a result, iron deficiency anemia may leave you tired and short of breath. You can usually correct iron deficiency anemia with iron supplementation. Sometimes additional tests or treatments for iron deficiency anemia are necessary, especially if your doctor suspects that you're bleeding internally. Symptoms? Initially, iron deficiency anemia can be so mild that it goes unnoticed. But as the body becomes more deficient in iron and anemia worsens, the signs and symptoms intensify. Iron deficiency anemia signs and symptoms may include extreme fatigue, weakness, pale skin, chest pain, fast heartbeat or shortness of breath, headache, dizziness or lightheadedness, cold hands and feet, inflammation or soreness of your tongue, brittle nails, unusual cravings for non-nutritive substances such as ice, dirt or starch, poor appetite, especially in infants and children with iron deficiency anemia. Causes. Iron deficiency anemia occurs when your body doesn't have enough iron to produce hemoglobin. Hemoglobin is the part of red blood cells that gives blood its red color and enables the red blood cells to carry oxygenated blood throughout your body. If you aren't consuming enough iron, or if you're losing too much iron, your body can't produce enough hemoglobin, and iron deficiency anemia will eventually develop. Causes of iron deficiency anemia include blood loss. Blood contains iron within red blood cells. So if you lose blood, you lose some iron. Women with heavy periods are at risk of iron deficiency anemia because they lose blood during menstruation. Slow chronic blood loss within the body, such as from a peptic ulcer, a hiatal hernia, a colon polyp or colorectal cancer, can cause iron deficiency anemia. Gastrointestinal bleeding can result from regular use of some over-the-counter pain relievers, especially aspirin. A lack of iron in your diet. Your body regularly gets iron from the foods you eat. If you consume too little iron, over time your body can become iron deficient. Examples of iron-rich foods include meat, eggs, leafy green vegetables and iron-fortified foods. For proper growth and development, infants and children need iron from their diets, too. An inability to absorb iron. Iron from food is absorbed into your bloodstream and your small intestine. An intestinal disorder, such as celiac disease, which affects your intestine's ability to absorb nutrients from digested food, can lead to iron deficiency anemia. If part of your small intestine has been bypassed or removed surgically, that may affect your ability to absorb iron and other nutrients. Pregnancy. Without iron supplementation, iron deficiency anemia occurs in many pregnant women because their iron stores need to serve their own increased blood volume as well as be a source of hemoglobin for the growing fetus. Prevention. You can reduce your risk of iron deficiency anemia by choosing iron-rich foods. Choose iron-rich foods. Foods rich in iron include red meat, pork and poultry, seafood, beans, dark green leafy vegetables such as spinach, dried fruit such as raisins and apricots, iron-fortified cereals, breads and pastas, peas. What do you think of our video? Let me know in the comments section below. Thanks for watching and I see you in the next video.